I recently treated myself and upgraded my Apple Watch with a stainless steel bracelet watch band that is so gorgeous that my husband seriously thought I'd spent a fortune and made comments about my watch bling. What he doesn't know is I got this gorgeous and elegant watch band from Quince for $50. And that's the thing about Quince. Elevated looks, high quality, and timeless style, all for way less than what you'd expect. And they have pulled out all the stops for fall. 100% Mongolian cashmere starting at just $50, washable silk tops and skirts, perfectly tailored denim, and the most beautiful wool coats. Everything looks designer level, but costs a fraction of the price. Quince makes this possible by partnering directly with ethical top-tier factories and cutting out the middleman. That means you get luxury quality staples at about half the price of similar brands. Keep it classic and cozy this fall with long-lasting staples from Quince. Go to quince.com/nursemo for free shipping on your order and 365-day returns. That's QUINCE.com/nursemo. Quince.com/nursemo. Hello there, I'm Nurse Mo, and welcome to Mo's Monday Minute, a shorty episode of the Straight A Nursing Podcast where I share a quick tip you can start using to improve your practice or habits right away. For more in-depth topics, check out the episodes I release on Thursdays. Something that comes up a lot in the clinical setting when you are transfusing blood is trying to determine how much you anticipate that one unit increasing the hemoglobin and the hematocrit. So here is a handy little easy thing to remember. So 1 unit of packed red blood cells, I was having a hard time saying that, packed red blood cells will increase the hemoglobin by about 1 gram per deciliter in an adult patient. For the hematocrit, it will increase it by about 3%. So let's say your patient's hematocrit was 25%. That hematocrit could come up to 28% when you give them 1 unit of packed red blood cells. Okay? Now, another common question that you will see and will be talked about, because a lot of times patients that are getting blood transfusions are also getting their H&H looked at, their hemoglobin and hematocrit. A very common scenario is your patient who has a GI bleed, for example. They will be on serial H&Hs, meaning we're checking them every 6 hours or every 4 hours or every 8 hours or whatever it is. We're just checking them around the clock. And if your patient is getting a blood transfusion and it's time to draw your lab for your H&H, you're not going to be doing that while they're getting the blood transfused. You want to wait a little bit so that all that blood can get into the system, circulate around, you can draw the lab and get an accurate reading. Now, you will hear people say, oh, you have to wait 3 hours. Oh, you have to wait 6 hours. Oh, you have to wait 4 hours. So I did a lot of looking, and there are lots of studies out there that have looked at the H&H levels 1 hour after, 4 hours after, 6 hours after, 24 hours after transfusion. And what is now the consensus is that the levels do not drastically differ between those intervals. And that means that you can check hemoglobin and hematocrit 1 hour after transfusion completion to get a good idea of your patient's true H&H or hemoglobin and hematocrit level. Now, of course, if your facility or your physician dictate a different time frame, like 3 hours or 2 hours or 4 hours or whatever it is, follow that. But if you really need to know, you can do it as soon as 1 hour after. I hope this helps you understand how much 1 unit of packed red cells can raise hemoglobin and hematocrit and when you would reassess that level. See you soon. This podcast is brought to you by Straight A Nursing, a proud member of the Airwave Media Network. For more educational podcasts, check out airwavemedia.com. And for more nursing-related content, go to straightanursingstudent.com.
Hi, this is Kelly Rutherford. You've reached the BioCell hotline. For more information about what BioCell Advanced Collagen Generator can do for you, press 1 for hair, 2, skin, or 3 for nails. 1. Hair. Experience stronger and thicker hair in 30 to 90 days. 2. Skin. A single-step beauty routine for skin with fewer fine lines and wrinkles. 3. Nails. The proven solution to stronger, smoother nails. Boost your own collagen and enjoy our clinically proven results.